For this self-study, we'll discuss patient relations in Chapter 12 of your text, page 139. The relationship between the patient and the dental personnel is very important to maintain a personal but professional relationship with the patient to decrease anxiety and increase comfort. There are some general guidelines for patient management. Try to appear confident. Don't ever say, "This is the first time I'm going to take x-rays on a patient." Explain what type of radiograph you're going to take on the patient and why you need to take radiographs so that you may see cavities in between teeth. It's important to answer patient questions. Use positive statements such as, "Are you doing okay?" or "Please hold still." Not negative statements such as, "This is going to hurt." Take easier films first, such as more anterior radiographs, because it is more comfortable for patients, and work quickly but efficiently. It's always important to compliment your patient. Some important patient relations is first impression. You need to maintain a professional attitude, know the patient's name, and make sure you always have your personal protective equipment on. It's important to maintain a positive personality trait and honest. Always maintain good verbal and nonverbal communication. Use layman's terms, and it is always good to show and tell what you're going to take, what kind of radiographs you're going to take on your patient. Patient education is always important. Explain the radiographs and the equipment to the patient. Our primary goal of a dental radiographer is a LARA, as low as reasonable achievable. Here are some answers to some common questions. What are the benefits of x-rays? X-rays find many diseases of teeth and tissues that cannot be seen to visible eye of dentist. How much radiation while receiving? A full mouth x-ray of 18 to 21 films is equivalent to 16 days of natural radiation in the environment. Why do you leave the room when you take an x-ray? A dental radiographer leaves the room because although radiation amount is small over a long period of time, the radiographer will have increased needless doses. These are found on page 143 to 144 in your text. Patient education in radiography is very important. Some education tools that you can state to your patient are x-rays are needed to see cavities in between the teeth and are individualized to patient's needs. It's important to show patients oral presentations and oral hygiene education literature to show the importance of dental radiographs to disclose pathology so the patient may understand dental treatment. Some communication tools are on page 140 in your text, box 12.1. It's important to use appropriate words for children and adults, such as layman's terms that they may understand. It's important to show positive nonverbal communication with your eyes and your hands. It's very important for pediatric patients to show a dental radiograph and show the different types of equipment. You need to verify that the listener has understood what you have said also. The next topic we will discuss is special needs patients. It's chapter 27 in your text, page 340. X-rays have to meet each individual patient because each patient presents with unique characteristics. We will review some conditions and how to manage these conditions while performing radiographic procedures. There are two reactions that occur prior to the gag reflex. These are cessation of respiration and the abdomen and throat muscles contracting. All patients have gag reflexes. It's just some patients are more sensitive than others. There's two stimuli that commonly initiate gag reflexes. They are psychogenic, the patient thinks they have a gag reflex, or tactile. radiographic film is placed too far back in a patient's mouth. Extreme gaggers may need alternatives, such as a Panorex taken, occlusals, or smaller films such as a 0 and 1. To decrease a gag reflex or prevent it, it is important to do the most anterior radiographs first, such as the centrals. Then you can move forward to the posterior radiographs, such as the premolar shot. To help prevent the gag reflex, you must convey a confident attitude to decrease anxiety. For the patient who has a hypersensitive gag reflex, you should expose the maxillary molars last. Always do the most anterior projections first. When you place films in the maxillary posterior, do not slide them along the palate. This will only enhance a gag reflex. There may be times when you encounter a patient with an uncontrollable gag reflex. When this occurs, you must use extraoral radiographs such as panoramic or lateral jaw radiographs. You can also use occlusals or smaller films. Some other things that you can do is use distraction techniques, such as breathing instructions or asking a patient to raise arms or legs to think about something else instead of their gag reflex. You can also numb the soft palate with a topical to decrease a gag reflex. If a patient has a hypersensitive gag reflex, there are commercial products such as edge protectors that you can slide along films to reduce the sharpness of the film and decrease tactile stimuli. The disabled patient is the next special needs that we will discuss. It's on page 344 in your text. A person with a physical disability may have problems which will limit activity with vision, hearing, or mobility. You must make every effort to meet the individual needs of each patient. In many cases, a family member or a caretaker accompanies the person with a physical disability to the dental office. You can ask the caretaker to assist you with communicating concerning the physical needs of the patient. You want to speak directly to the patient and don't ask any personal questions about their disability. Wheelchair-bound patients who can temporarily support weight can slide with assistance or transfer themselves into a dental chair while receiving x-rays. An immobile patient may need to be lifted into the chair. Sometimes x-rays and treatment can be done with the patient in the wheelchair. Make sure the patient is positioned within the range of the x-ray unit, extension arm, and tube head. The next special needs patient that we will discuss is the apprehensive patient. An apprehensive patient may consider the radiographic procedure to be unpleasant. It is the dental radiographer's job to decrease this patient's apprehension. To do this, you can be organized, rapid, and accurate. Again, always make sure to expose the maxillary anteriors first, then the posterior areas last. It's important to reassure the patient and calm their fears. Compliment and thank the patient. Develop a rapport with the patient by explaining the procedure. Project confidence, gain trust in the patient. Maintain authority by controlling the procedure, but be gentle and firm. On chapter 28, page 350 in your text, there are some anatomical limitations, such as tori, shallow palate, the shallow floor of the mouth. It's important to use the bisecting angle technique to help with these certain anatomical limitations. An exposure technique in which the central beam of radiation is directed perpendicular to an imaginary line that bisects the angle formed by the recording plane of the image receptor and the long axis of the tooth is the bisecting angle technique. Tori are a benign outgrowth of bone in the oral cavity. Care should be taken when placing the image receptor in the presence of tori and should not be placed directly on the tori. When a patient has maxillary tori, it is recommended to take a PA first, then bite wings. If a patient has maxillary or mandibular tori, place the film on the opposite side of the palatal torus, away from teeth being radiographed. The film should not rest on the torus. If there's mandibular tori, use a PA and place the film between the tori and the tongue. If you're taking bite wings, place the film between the tori and the tongue. Make sure and push the film away from the teeth. If a patient has a maxillary tori, use a PA and place the film on the far side of the tori, never on top of the bony projection. The film may be angled in the mouth to facilitate placement when using the tabs. If there's lingual tori present, the film must be placed lingual to the torus. Make sure the film clears the palatal gingiva as the patient closes to keep film from being pushed down into the mandible. Here you can see that the film is shown placed between the tori and the tongue, not directly on top of the tori. If a patient has ankyloglossia, which means tongue-tied or congenital oral anomaly caused by a short, thick lingual frenum, it decreases mobility of the tongue. It is important for the dental radiographer to use a tongue blade to support the film so that the x-ray portion is over the tongue and not superimposed over the roots. Patients can also have a shallow palate. This is on page 352, figure 28.5. It is important to tip the film away from the teeth with a snap array to increase vertical angulation and use bite wings and 2 cotton rolls when placing the bite wings. Patients with shallow palate need to tip film away from the teeth with a snap array. Here you can see the snap array, which is just a film holder. It's important when a patient has a shallow palate to increase vertical angulation by increasing the PID and using a snap array. In this PowerPoint slide, you can see that the patient has a shallow palate here, but they are holding the film. This is not acceptable because they are not using the Olara concept. The radiation is not as low as reasonably achievable. We would rather you not have the patient hold the film as in this PowerPoint slide. On page 356, you may have a patient who has the inability to open their mouth fully. It's called tetanus or lockjaw, or trismus. If this happens, use a periapical film with a hemostat for the patient. Clasping the film with the hemostat, insert the film in the mouth with the film parallel to the floor, horizontal. Once the film has cleared the incisors, rotate the film to a vertical position in the maxilla or mandible. The employment of a hemostat, a dental instrument, is custom made for a patient with trismus.